Today we will be talking to you about fecal microbiota transplants as cancer treatment. PD-1, or programmed cell death protein 1, is a cell surface protein involved in downregulating the immune system and promoting self-tolerance by suppressing T-cell inflammatory activity. Its purpose is to prevent autoimmunity, but can also prevent immune cells from identifying and killing cancer cells. ICIs, or immune checkpoint inhibitors, are a new class of drugs that include anti-PD-1, or PD-1 inhibitors, and anti-PDL1, or PDL1 inhibitors, which inhibit the PD-1 ligand. These block PD-1 and PDL1 respectively, which are immune checkpoint proteins. This blocking activates the immune system to attack tumors, and as such are being used to treat certain forms of cancer. ICIs, sometimes combined with chemotherapy, are now being used as a first-line treatment for cancer. Some patients have shown resistance to PD-1 or PDL1 blockade therapies. Studies have shown that the gut microbiota strongly influence the efficacy of these therapies. The bacteria A. municiphala and members of the taxa Ruminococcaceae were found to be overrepresented in patients who responded to treatment, which was corroborated by a study that performed fecal microbiota transplants containing these bacteria into germ-free mice and seeing how they responded to PD-1 blockade. Patients with abundant Bilophila and Sutterella also tended to have a decreased time to treatment failure. Dendritic cell function and the accumulation of CD8+ T cells were increased in the tumor microenvironment in mice with bifidobacterium in their gut microbiota. Researchers have found that patients that were administered antibiotics 2 months before and 1 month after the start of anti-PD-1, PD-1L1 therapy had a significantly worse survival rate than those who did not receive antibiotics. The overall systematic activation of the immune system by the gut microbiota seems to determine the potency of PD-1 blockade. Some possible mechanisms for how the gut microbiota modulates anti-tumor immunity are the activation of interferon gamma pathways, production of IL-12, induction of the Th1 immune response via the activation of dendritic cells, and the maintenance of Tregs. Many other factors, such as diet, obesity, genetic background, and geographical region, can affect the composition of the gut microbiota, so further studies are required to identify absolute species and, perhaps more importantly, metabolite abundances and molecular mechanisms that can affect the efficacy of anti-PD-1 or PD-L1 therapy.
Because certain microbiota are shown to aid in cancer treatment, fecal microbiota transplantation, or FMT, could be an answer. FMT is defined as the transplantation of gut microbiota from healthy donors to sick patients via the upper or lower gastrointestinal route to restore intestinal microbial diversity. FMT is recognized as the most innovative and dramatic method due to its ability to alter recipients' gut microbiota. The utilization of feces for the treatment of food poisoning or severe diarrhea was firstly recorded by a well-known medical expert named Ji Hong approximately 1700 years ago. Currently, FMT has been approved as a clinical method for treating recurrent CDI, which is an inflammation of the colon caused by the bacteria Clostridium difficile, by 2013 guidelines, and its clinical effectiveness has reached approximately 90%. The observed intestinal dysbiosis in cancer patients leads to an increased interest in the potential of FMT for the management of cancer. There are many studies showing that the presence of specific gut bacteria are linked to an increased efficacy of cancer therapies targeting PD-1. How does it work? Fecal donors are either close relatives, family members, or unrelated individuals. However, where possible, fecal material is best sourced from a healthy, unrelated individual from a centralized stool bank. To eliminate the risk of inadvertently transmitting infection, donors in preparation of FMT should be screened. Fecal microbiota can be delivered via capsule, nasogastric tube, nasoduodenal tube, enema, or colonoscopy, but the optimum route of administration has not yet been determined. There are possible complications of FMT, and they include intestinal perforation, physical injury by the insertion of the enema, colonoscopy, or nasoenteric tube, transferring a parasite or pathogen if it is done without screening beforehand, dysbiosis or unbalanced gut microbiota, or in very rare cases, transferring characteristics such as obesity. More studies still need to be done to determine the risks of FMT. These studies show the bacteria is linked to success in immunotherapies targeting PD-1 or PD-L1 and includes their possible mechanisms.
Fecal microbiota transplant, or FMT, is emerging as a strong contender for the treatment of advanced melanoma as well as other cancers. Currently, melanoma has the most going for it in regards to treatment. Researchers have identified that melanoma patients have bacterial species and phyla such as actinobacteria and firmicutes, which are the most reactionary to immune checkpoint blockade with monoclonal antibodies and the targeting of PD-1. Seeing as the gut microbiome is a major tumor extrinsic regulator of responses to anti-PD-1, FMT makes sense as a method of treatment. In one study, 40% of patients reported long-term benefits from FMT, and in another study involving melanoma-bearing mice, FMT promoted anti-PD-1 efficacy. FMT greatly affects the gut microbiome and is continuing to become more significant in the realm of cancer research and cancer treatments. In the particular study analyzed forth, 16 melanoma patients were enrolled and studied between June 2018 and January 2020, with results being cut off in September 2020. Each patient had no prior response to anti-PD-1, meaning that the patients were PD-1 refractory. The recipients of fecal transplants and their donors all underwent serial stool sampling and infectious studies prior to the study. In order to really understand what was going on in the gut microbiome following FMT, the researchers performed shotgun metagenomic sequencing of 233 fecal samples provided by donors and recipients. This revealed that the gut microbiota of recipients changed after a single FMT, which continued unless a significant upset, such as antibiotic use, occurred. With regard to the immunological effects of FMT, the researchers performed flow cytometry and single-cell RNA sequencing from peripheral blood mononuclear cells and tumor samples, and ultimately it was found that FMT was able to expand the activation of T cells in patients. Figure 2A in the presentation displays a plot of microbial taxa of the patients who received FMT at different points in time, and each color represents a different patient. The squares are pre-FMT and the triangles are post-FMT. Figure 2C displays the taxonomic rate of change of stool samples obtained from treated patients. This research has found that a single administration of FMT is able to successfully colonize the gut with different microbiota in a way that benefits melanoma patients that have the immunological response to react to cancer, but not the proper gut microbiota composition to successfully do so. Seeing as the microbiome's involvement in cancer has only been named significant in the past several years, there is still plenty of untapped potential in the field of FMT. Some possible research opportunities include a similar study with larger clinical trials, as the main study analyzed only had 16 participants. Research could also be conducted on how to better identify biomarkers, such as the microbial, circulating, and intratumoral biomarkers for patients that may better benefit from an administration of FMT, and other procedures that can aid in the identification of who would be the best candidate for FMT treatment. Being able to make the best out of FMT with other cancers also has a wide variety of research opportunities, especially given the gut microbiome's composition and its complexity that has not been defined quite yet. FMT shows great potential in the battle against melanoma and cancer, and the only way to harness that potential is through more extensive research.
Thank you for listening, and if you have any questions, please let us know.